today's our guest is Dr. Sadath Seth.
Let me thank you first of all, the IFPH, for inviting me again. Today, I really don't know. I'm just going to start with my experience from the stomach disorders or any abdominal disorders we have started with. That's my experience. When I tell you my experience, it's experience from my practical experience of my clinic. Statistic wise, if I cannot even count how many patients we have given these medicines. So many patients we must have given these medicines. How the clinic, how a clinician comes to, or a patient comes to my clinic. That's something which we have to learn. A lot of cases we know how to take the cases. A lot of seniors and everyone are talking about classical methods of practice, everything. But my way is when acute comes in, what to do, how to take case. Case taking is okay, everyone knows. But what are the medicines to be prescribed? What are the medicines to be thought of? How to handle this acutely? That becomes a little more tougher. And I think these medicines can, what I'm going to tell you is can help you in many ways. The basic thing is, how do a patient comes into our clinic? Once the patient comes in and starts explaining, I got a wonderful experience today. I don't know how to handle the things. I'll tell you that experience and we'll go into directly into the cases. A 14-year-old boy has been under many treatment, including homeopathy from different doctors. Allopathy, Ayurveda, homeopathy was the last thing. The best part is that they went to the homeopathic doctor. She prescribed few medicines and his complaint was better in 2 days. Okay. And after some time, a week or two, they came to me. In 2 days' time, the patient was better. I said, if it was better, you should have continued there. Why did you come to me? They said, homeopathy better in 2 days. That is giving us a suspicion. And how can a homeopathic doctor can give us such a relief in 2 days? She must be adding something else. I said, you went to all other doctors. They have given you medicine. More than that, homeopathic doctor doesn't know how to add another allopathic medicine or something into homeopathic medicine. They have given all the allopathic medicines. You are not better. When a homeopathic doctor is giving you relief, why don't you stick with them? I said, no, we have some doubt. Okay, fine, come. And the same doubt is continuing still now. The patient is with me. Why I'm telling you all this is, patient had a GERD. But the problem with him right now is pain below the umbilicus, just above the pubis bone, nowhere else. Okay, it is not radiating, it is not going anywhere, it is not having any other pain, only pain there. Aggravation food, aggravation night 8 p.m. to morning 6 p.m. This is the only this one symptoms I am getting it. All examination done, everything pressed, everything palpation was done, nothing, only no pain, nothing, only the symptom is this. So they are also panic. We are also panic because why pain there? You cannot. I cannot even diagnose. So I had to call up my regular sonologist. He started helping me out, saying that it could be a symptom of a GERD, but get a scan done. So diagnosis is more important to convince patient. You can give any number of medicines, but diagnosis comes first thing in the treatment of homeopathy. Diagnose the case first. Now the patient is happy. It is diagnosed as GERD. No other complaint. They are comfortable. That is the first thing we have to do. Any pain abdomen or anything related to abdomen, examine the patient. That's the first and foremost. Take the case. Once you know that, okay, this could be connected to your abdominal issues or stomach issues or whatever it is, examine the patient. Put the patient on your bed, examine. So once you start this case, I could save it because I could tell them, okay, this is GERD, nothing to be worried, continue medicines, he'll be okay. Yesterday we diagnosed the case, today onwards he is better. I'm not telling it's because of my medicine. It is because I have diagnosed the case clearly and they are peaceful at mind. They are sure that okay, there is nothing left out. They are thinking about cancer, they are thinking about prostatitis, they are thinking about a lot of other companies. So they were confirmed. That is something which we have to think about it before taking the case. Diagnosis. Examine the patient thoroughly, especially abdominal. Abdominal cases without even touching the abdomen, we give medicine. Please do avoid that. Take the case, examine the case, diagnose the case, then the medicine comes. Okay. So I'll start with my experience of giving the medicine. Patient comes to us with telling that I've lost appetite. I know a lot of medicines are there, Nexomica to hydrasis to everything. But my first medicine is lecithin. My first and foremost prescription could be lecithin. Lecithin has this anemic also, plus that craving is there, the pain is there, appetite, no reason. You cannot even tell you what could be the reason, nothing. If it is anemia, if it is HB low, and he has got appetite low, and the stomach, if you examine, you don't get anything, then think about lecithin also, along with other medicines. Okay, lecithin also can be used to increase your breast milk. Causes immediate decrease in phosphate secretion of through the urine. Lecithin has been given successfully with a case of a kid. It is going on. A kid walks with the on toes. Exact medicine is given on toes. So think about those cases where there is a tendo-Achilles pull or a shortage of the muscle or anything of that sort. Think about lecithin. Okay. Then strychnine. Strychnine force. Strychnine and nitricum can be thought about craving for alcohol. Alcoholism. Strychnine as also, the strychnine group is very important even in the stomach cases. Strychnine group, strychnine as is one of the best medicine for diabetes. We hardly use it, we hardly think out of the box. Okay. At times we have to tell the patient to bring the sugar down because 400, 500, 300, 400 patient gets panic. Bring the medicine, sugar down. Fluoridazine, another one of the best medicine for the bringing down the sugar immediately. Then you can think about taking case, emotional disturbance, all that stuff. You can think about it. If constitution can be given, all that is a part of our treatment. Everyone does it, including me. Another one is appetite perverted, cravings. Everyone comes in. 90% of the patient comes in with this kind of a symptoms. The medicines are, we give antium crude, antium tartars, everything. But along with that, acid first 30 or 30. Give it for few days. You will get the result. Macab. Macab is another medicine which has even helped in COVID. Okay. So along with fever or anything of the sort or abdominal problem, the smallest of the ulcers, if you have a perverted appetite or craving, think about Macab. Okay. And craving aversions also. Most of the cases has this. Hematemesis. Hematemesis is another complaint we get it if there is a gastric ulcer or duodenal ulcer. These two things we'll have to think about it. If there is an occult medicine, occult blood, examination, investigation, lab investigation is a must, even in the case of hematemesis. Hematemesis, occult blood, we have to find out if it's an occult blood or a fresh blood. Okay. So fresh blood, if it is a fresh blood, we have a lot of other diagnostic criteria and with the medicines, with the kind of a blood you see, fresh blood, our medicine itself is changing. It can think about the phosphorus to hemamelis to bilifolium to lot of other medicines. Okay, so how do we differentiate? Is lab investigation is needed? No, that is a uh, sign. If there is an hematemesis or rectal bleeding, fresh blood, polyp to what are called hemorrhoids, fissures, polyp, fistula. Uh, you should think a lot of it. Then differentiate the medicine according to the patient. Emergency or acute, you handle with acute complaints or acute medicine. Constitutional medicine like ulcers and this one is not a fresh ones. It has a long duration. Think about constitution along with your mathematic and other things. Cocaine, hematemesis. You just think about these medicines. Cocaine is one of the best medicine you try. Cactus. We never think about cactus. In the case, we think about cactus only on the cardiac complaints. We have got a pain or something, so we just think about cardiac complaints. Okay, diagnose the condition. Then hiccups. Hiccups are very common. 90% of the patient abdominal complaints comes with hiccups. Continuous hiccup, gas formation, cajaputam. Cajaputam is one of the best medicine other than carbo vegetalis. Every medicine is there. I'm not denying all that. Everyone has tried that. Every senior doctors, the junior doctors first thinks that Kajaputam, this one, Nexomica, Carboveg, everything. I'm not that medicines are very good, but along with this, try this medicine also. Kajaputam is one of the best medicine. It is also called Oleum vitnabunum. Kajaputam is commonly available. The one of the best medicine. Okay. Hiccups. Another thing medicines to be thought about is morphinum. Morphinum 30 is one of the best medicines. Zingam valerianum. These are my experience. I'm telling you this experience even if after giving a 50, 60, 70 patients cases. More than that. Okay, morphinum is one of the best medicines. Hiccups will go immediately. Zingam valerianum will go faster. Both the medicines are very good. I'm not denying all the other medicines. Seniors, these medicines are important. Hyperacidity. We always think about Kali bike to Nexomica to Hydrastis to all other medicines. This is Oraxanum tannum. Try this. You will get it. It's available. Oraxanum tannum. Okay. Boric has given it. Try this medicine. Indication is severe hyperacidity. Robina is one of the another best medicines. You can think about it. Oraxanum tannum is one of the best medicine. You try this in patients. You will have a good result. Okay. Indigestion as per the cost. That is important. For the indigestion, causation is more important. If you get a good clear causation, some people will come and say, I don't know, doctor, what I had yesterday. I just had a simple meal what we cooked at home, but they forget to tell you. They must have also had something else from the hospital. Okay. Indigestion as per the cause. If it is indigestion because of the sleepiness, okay. Indigestion due to cholelithiasis. Natramure is one of the sleeplessness. Okay. Natramure is because we have a lot of this temple festival, church festival. Everyone we go for late night movies. At least city we at least might ticket timing is at 10 o'clock. I book only for 10 o'clock show. So 12 o'clock, 1 o'clock we come back and sleep till. So at times sleep gets disturbed. Natramure is one of the best medicine. Natramure we hardly and rarely think about for the indigestion. Try this. Okay. Next, mosqueta. Pelturi. Pelturi is one of the best medicine if there is a cholelithiasis or gallstone problems. Epiphysis. Okay. Epiphagus is one of the best medicine even for the indigestion due to sleeplessness. Headache due to indigestion. Okay. Ignatia is one of the best medicines. Why? I'll tell you the contradiction. Indigestion cannot cause your headache because indigestion happens in the stomach. This happens in the head. So what is the connection between indigestion and head? So it's a contradictory. Always Ignatia is a contradictory medicine. Okay. You have this one laughing when they are sad. Some contradictory. Every time there is a contradiction. We cannot even think about a proper symptom connection in the Ignatia. That is also used here. Gastritis. Gastritis, one of the best medicine is Kali bike. I can even tell you pain in the epigastrium. You can even close your eyes and give it. Kali bike. If you don't get a constitution or clear-cut medicine or anything like that, to not even to give relief, it can bring you the cure also. Why Kali bike is? Kali bike pain is in spots. That is why every pain of Kali bike is in spots. Gastritis, epigastrium, there will be a pain on the spot. Okay, it can be esophagitis, or it can be antral ulcers, esophageal esophagio-pyloric ulcers. Kali bike is one of the best medicines. Gastritis due to alcohol. Gultheria, cuprum. We hardly think. I can even give you thousands of cases of alcoholism. Only 10-15 medicines. Because 99% of the cases of the alcoholic patients have not seen. Relatives come and tell that he has got alcoholism. Why don't you start medicine? So we have got a lot of medicines. I'll just ask one or two or three few questions. Give the medicine. So gastritis, if it comes to acute gastritis, think about cuprum and gultheria, also along with nexomycia, along with other complaints, Kali bike, whatever the medicines you have known, along with all that complaints, along with the constitution, along with acid nitricum, along with acid sulfuricum, along with other complaints, these two medicines also ranks good. Nausea. First medicine comes as ipecac. Why is phrenic nerve involvement? Okay. Other thing medicines can be petroleum, apomorphinum, and morphinum. Petroleum, apomorphinum, and morphinum. Okay. I just wanted to tell you one. This is not related to the stomach, but it is related to the uterine bleeding. And thank you to Dr. Anil and Dr. Jodi. Epihisterinum, that has worked wonders. Epihisterinum 30 has worked wonders in stopping the excessive bleeding. Trivandrum Anil Kumar, your treasurer. Okay, so we should appreciate all this. You should learn from small things and give that. Do the trial in your clinic. It has given me a good result. Okay, so I'm just adding it to it. Nausea, petroleum we never think about. In indigestion, we think about petroleum while riding in the carriage. Vomiting, nausea, all that comes up while riding in the carriage, not associated with your stomach. Petroleum and apomorphinum and morphinum. And depends upon the specific cause. If it's a specific cause, you have a lot of medicines are there depending on the specific cause. Burning suspected of gastric ulcer. Burning suspected of gastric ulcer. Every time the patient comes and tells me, I have got a great burning. Trials of burning is there, sulfur is there, all that is there. Along with that, go for Condurago. This is Condurago, not CU, it's CO, Condurago and oxalic acid. These two medicines are one of the wonders. You try this along with, or what are the medicines you wanted to try, but try this also. Epigastric pain, another one. Only pain. Abies canadensis, Abies nigra. Abies nigra and Abies canadensis, they can give you as if something lodged. If you get that, nothing else. Raphanus is also there. Globus hystericus, Raphanus is also there. But along with this, Abies canadensis and Abies nigra. If it is the patient is aged, Abies canadensis. Okay. Gastritis and gastralgia with constipation. Plumbum met. Gastritis, gastralgia with constipation. That is a PQRS symptom. If you have constipation along with gastric burning, PQRS symptom is plumbum. Okay. Another symptom is abdomen distended, tight clothes intolerable. Usually we give it lacasis. First and foremost thing we think about is lacasis. But these two medicines, graphitis and ambra, is one of the best medicines. You can even think about it in better way. Abdomen distended, tight clothes intolerable. You can even think about lacasis. Lacasis is the first and foremost medicine we all think, but these medicines can be thought about. Okay. Empty, faint feeling. Empty, faint feeling in the abdomen or epigastrium. You have all the lot of medicines, but Barata, Mure, try that. That's not because of that. Maybe my video. My video something has some issues. Okay. Sorry. Empty, faint feeling is Barata, Mure. I'm not denying all the other medicines. Constitution, I don't know, but Barata, Mure is one of the best medicine in my experience. Has given me the best results. Sometimes patients come and tell you there's a pulsation, there's a throbbing in the abdomen or in the epigastrium or anywhere. Crotalus horridus. Clear-cut symptoms you get it here. Patient comes and patient will come and tell you, doctor, I have no other feeling other than once in a while this. I have got a as if some palpitation in the stomach. Or if it is in a local language, you know, no. So there's a palpitation like a heart palpitation. I'm feeling it here, or I'm getting a palpitation on the abdomen or epigastrium. Crotalus horridus, you think about it. This is common symptom. I'm not talking something very rare or anything. Ulcers. The juniors are not getting anything else. Geranium maculatum, Mercol, ornithogalum. Calibike, everything is an exomica, all that is there. But Geranium maculatum is one of the best medicine. Mercsol and Mercury group, Mercsol, Mercor. Ornithogalum is one of the best medicine. Try that out. Vomiting in drunkards, non-stopping vomiting in drunkards. Give Cupromet. This medicine I can even, I don't know how many I have given it. Cupromet has helped me a lot. I have a history of listening to this patient. Few patients come and tell me, oh, alcoholism, they, what called, one patient, one or two patients came and told me, one patient after drinking, he goes into the kana or the sewage. He takes a rat. He picks up a rat, he kills the rat and give it to the wife. Wife has to cook the rat and give it to her. That medicine and it is syphilinamide treated with the alcoholism. Okay, rat meat. He wants to eat after alcoholism. Nothing else. So that's one of the best experience. Syphilinum helped me. So vomiting in drunkards. One or two dose. The patient starts vomiting. Not one vomiting, starts continuously vomiting. Cupromet is one of the best medicine. Vomiting in pregnancy, that is also part of the stomach. We have amygdalase to Lot of cases. Cuprum aceticum. I don't know how many have tried that. Cuprum aceticum, lactic acid, and MAC-carb. These three medicines also can be of lot of help for you if you don't get relief from all the other medicines. Food undigested. Ferromet and ferromet is one of the best medicines. If it is given in a lower potency, that gives you more result. Okay, ferromet 3x to 6x will give you one of the best, one of the good results. Food undigested. Passes food with undigested. Lycopodium is there, but ferromet also can be thought about. Okay. Flatulence, distension of the stomach. Again, Kajaputam. Lachesis. Lachesis because it's sensitive. Graphite is in next mosquita. Next Nexomica, Carboage, and all other complaint medicines are there, which we commonly use it. But these medicines can be thought about and used very effectively because homeopathic Metriamedica has all 4,000 medicines. We have humpty number of ways to reach into the one simillimum. We have Kentian method, we have Boric method, we have Bonninghausen method, we have Murphy, we have every road leads to Kochi. Same way it is. You come to from Kottayam, it should reach Kochi. So however you come, medicine has to be this one, patient has to be better. Okay. Flatulence of distension of stomach, Kajaputam is there, Lacus is another one of the best medicine, Graphitis is there, next Muscata is there. Okay. Pain immediately after eating. Patient will come and tell you, doctor, if I eat something, I get pain. We ask them, after how much time? Is it on the spot or after some time? To differentiate duodenal ulcer with other ulcers. So gastric ulcer and duodenal ulcer, the main diagnostic feature is the pain comes when and how. Sorry, I don't know why this is happening.
But when you are coming forward, it is not.
It is there always. I'm touching
No. Now.
Okay, focus.
Now it's okay, but
it's okay. Forget it. Okay. Pain long time after eating. Agaricus. Pain immediately eating is Kalibike and Kalikab. Okay, pain immediately eating is Kalikab and this one, Kalibike and Kalikab. Pain long time after eating is Agaricus. That's one of the best medicines for gastric ulcers or duodenal ulcer. Okay, pressure as if it's from a stone. This is all we get it every day in the clinic. Doctor, I feel as if something is there in the stomach. As if something heavy after food, as if some, in local language it's been karingal, it's a rock that has been kept in the stomach. That is why the diagnosis is important. It could be a feature of a CA stomach, so we should diagnose it. Okay, so pressure as if from a stone, abyss nigra and phosphorus. Phosphorus is my favorite, all-time favorite. It's one of the best medicine, even from viral fever to uterine bleeding. Phosphorus is one of the key medicines I have faith on. Abyss nigra is one of the best medicine. Think about it. Regurgitation, sore regurgitation, pulsatilla and phosphorus. Try this, pulsatilla and phosphorus. Phosphorus again, phosphorus is universally what called? We say no. polycrust. For me, phosphorus is a universal polycrust. Okay. Gastritis, another medicines can be thought antimtat. Beautiful antimtat and phosphorus. Gastritis from alcohol, we are told. Nausea, we have told you everything about this. Pain, abdomen, aggravation, beer. Aggravation, beer. Pain, abdomen, aggravation, beer. Kali bike. There is no second thought. Okay, Kerala is flooded with alcoholics. So beer is giving you pain, Kali bike. Aggravation from food, any kind of a food, argentum nitricum can be thought about. Other than that. Okay. Empty, faint feeling. Again, murex, phosphorus, Apis canadensis, and lobelia. Along with, I just added one or two medicines for lobelia. For the ulcer, another medicine is symphytum. Symphytum is one of the best medicine for eye injury. Along with that, symphytum is medicine for any ulcer. Along with that, gastric ulcer and duodenal ulcer. Symphytum. Okay. Instead of sticking it to one medicine, think about the symptoms of few medicines. These are one of the best medicines. Vomiting, I told you. Drinks of any kind cause vomiting. If he drinks water also, he vomits. Bismuthum. Cantharis, we hardly think about it. Epitorium perfoliatum. Phosphorus, another best medicine even for this. Okay. Cupromas is also one of the best medicines for the drunkards. Nexomica, as usual, it is there. Appendicitis. Iris tenax, everyone knows it. The iris tenax, bryonia, majority of the cases can be treated with iris tenax. Okay. Heartburn. Another iris group is there. Iris was. It is like burn from esophagus to not esophagus down to the rectum. Iris versicolus. Abdomen colic pain. Cajaputum plumpum met. This plumpum met is one of the best medicine for what is that? Intussusception. Intussusception. Colic plumpum met 200. I can even specifically, thanks to Dr. Chandrabanu, plumpum met 200 intussusception. Okay. Colic biliary gallstone, Berberis vulgaris and Colosin. Flatulence colic, Polygonum punctatum. Flatulent colic. If you don't get anything else in your mind, if you are confused, if you are a beginner or anyone, Polygonum punctatum. That's one of the best medicines. Hemorrhoids also you can use it. Skin superficial ulcers also you can use it. And sores, especially in females. Superficial ulcers, especially in females. When the females walk, these two thighs gets rubbed. And there comes the ulcers of the skin gets cut. Especially fatty females, if they walk, you can give calendula all that. You can think about Polygonum punctatum also. Cajaputum and argentum nitricum. Umbilical pain, granatum, especially for the kids. Fistula anno, pioneer. Fistula anno, I know everyone is an expert in treating fistula anno. But fistula anno, before treating it, go for a fistulogram to find out. See, we cannot just tell them, okay, we can't just tell them, okay, this is cured, that is cured. We need an evidence. So before you start, ask them to get a fistulogram done. Plus, during also you can ask them to find out what is the progress of the treatment. Okay. Okay. So go for a fistulogram before starting fistula treatment, because we need advice, evidence. We have done this. Okay. Hemorrhage during stool. Merc salt to merc core to everything we tried. If you are not successful, try alumen. Not alumina, it's alumen. Okay. Inflammation of the rectum, proctitis. Where do you get this? Lactose intolerance. There's a red color. Lactose intolerance. Sulfur is one of the best medicine. Kids, chamomile is another medicine. Colinsonia. Okay. Colinsonia is one of the best medicine. Sulfur, 90% of the cases it gives you results. Colinsonia is also another one. Itching of the rectum. Only itching is there along with the hemorrhoids. Colinsonia, indigo. Saccharum lactis. Saccharum lactis, saccharum lactis. We have medicine. Indigo, sugar of milk. Okay. Saccharum lactis 30. Indigo is another medicine. Indigo 30 gives a better, good results. Colinsonia is also another medicine. Long lasting pain after stool. 100% mercor is the first medicine, but graphite is also another one of the medicine equally important. Sedum acre is another equally important medicine. This is from my experience. I know 101 doctors are there, seniors are there. They have a lot of other experiences. Yes. Prolapse ANA, if it is, you cannot manage your first degree, you can think about treating it. Second degree also, you can, after that, don't ever keep it. Refer it. Okay. That's my experience. I don't know about seeing other people. They must be having a lot of other. My experiences, I don't take those cases because it's not easy. Especially 3-4 postpartum, 3-4 after 3-4 deliveries. Especially Muslim families, you get this. Okay. Because they have, my grandmother, she used to tell me I have 12 kids. My mother's died 12 kids, 9 kids or 10 kids. I don't know how many counters there's still now. So all these conditions you get prolapse of ANA also, prolapse of uterus also. Okay. Constipation due to hemorrhoids, colinsonia, Aesculus glabra. Aesculus glabra is one of the best medicine even for esophageal varices. It is almost specific for esophageal varices. Aesculus glabra 3x or tinja. This is my experience. Okay. Constipation in infants. I know that everyone has been treating infants. It's a common case in any clinic. Colinsonia is another one medicine. Paraffin. Paraffin is one of the paraffin 30, paraffin more than that. If you get it, try that out. Okay. Pancreatinum. Pancreatinum is one of the best medicine. Medorinum. Medorinum is one of the short medicine if there is a megalacolon, congenital megalacolon. How do you differentiate? Parents will come and tell you the kid wants to go only in standing. He cannot sit and pass. He screams if he wants to sit. He can pass only while standing. He's scared of going to the toilet. He has to pass only while standing. So that could be a cause of congenital megalacolon. Give medorinum, that too in a higher potency. Okay. Constipation in old people. Selenium. We know Baraita Kaptu, all other selenium. Because selenium is weak, it gives a nervous weakness. It can be one of the best medicine thought about in erectile dysfunction, hair fall. Okay. Diarrhea. Gambogi is one medicine. I'll tell you later. I don't know. I am just not getting the full explanation. NUPH, we tell that I write it NUPH to the patient, to the staff. So that staff is taking care of it. Diarrhea, another continuous diarrhea. Know the patient is active. Kid, phosphoric acid. Okay. Diarrhea after fatty food. all nut, pulsatilla. Even cholesterol also you can be thought about it. Cholesterol, because fatty diarrhea after fatty food. What could be the diagnostic processes? Cholelithiasis. Okay, cholelithiasis. If you have it, this sometimes could be. Sometimes the gallbladder would have been removed also. So you have to ask for the history. Diarrhea after fatty food, pulsatilla, cholesterol also can be thought about it. It's one of the best medicine. Spluttering expulsion. The patient who goes sits in the toilet and everyone can know that he's in the toilet. Okay, Jetrofa is one of the best medicine. If his wife or relative or anyone tells that doctor, if he goes to the toilet, everyone comes to know that he is there in the bathroom. Jetrofa can be thought about. Okay, frequent diarrhea wants to go. One he comes down, then goes up. Frequent diarrhea, cupromas, phosphoric acid, Merck valeriana. Along with this, these are the three regularly used medicines by me. Involuntary when passing flatus. Patient comes and tells you that when I say pass flatus, small quantity of stool passes along with that. Oleander, again phosphoric acid. Acid phos is one of the best medicine for hair to any complaint, even for the urinary complaint, phosphates, everything. Phosphoric acid is, you have to read. You have to read phosphoric acid. It's one of the best medicine. Involuntary when passing urine. When you passes for flatus, oleander and phosphoric acid. When he passes urine, muriatic acid. Think about it. Causticum is there. Another medicines are there. Muriatic acid, we rarely think about it. So think. Offensive stool, terebinth and sorena. Terebinth and sorena as one of the best medicines for offensive. All other of a carbo animal is a carbo which is there. So these medicines also can be thought about.